I'm Nate Lebowitz. I'm a clinical cardiologist and lipid specialist in northern New Jersey. I'm assistant professor of medicine, Department of Internal Medicine at Hackensack Meridian School of Medicine. In the last couple of years, I've gotten interested and really studied and learned a lot about Pitavastatin, or brand Zypitamag. What I've come to find through a lot of experience with patients is that it's fundamentally different in a better way, and I find that it's much, much safer for patients. So it's kind of an open secret that many statins could raise your glucose, and even if you're predisposed, cause diabetes. But Zypitamag, which is a brand of Pitavastatin, does not do that. And there's some even possibilities that it may improve glucose control. That's yet to be fully proven, but there are hints to that degree. Statins deplete your coenzyme Q10, which may be associated with why we sometimes see muscle aches and risk of muscle breakdown in a lot of patients. But Zypitamag doesn't do that. So we really don't see muscle aches very often at all compared to other statins. Statins are metabolized by, just like many, many other drugs, by an enzyme system in the liver called the cytochrome P450 system. And that's where drug interactions and possible liver toxicity can occasionally occur with statins. But Zypitamag is not metabolized by that system. So I don't see much liver function abnormalities, and it's known that there are very few drug interactions. So people that are on specialized medications like HIV meds or transplant meds, or people who are on a lot of medications, definitely a good choice. And whereas you might need 20 or 40 milligrams of other statins, here you 4 milligrams will lower the LDL cholesterol 45%, which is a lot. Furthermore, some statins even lower the good cholesterol or have a neutral effect or minimal effect on the good cholesterol. Zypitamag can actually raise the good cholesterol more than these other statins. So for many, many reasons, it just seems so much safer. It doesn't seem to do so many of the occasionally worrisome things about statins. And I think it's a phenomenal choice for you. And even when it's not covered by your insurance, which in my experience is going to be roughly about 70% of the time, you can get a safer brand version, Zypitamag, for an affordable cash price of a little over $100 for 3 months supply. So you can still get this drug, which is going to be so much better and safer for you, through Marley Drugs in North Carolina, where they're incredibly nice. And they just call you and they ship it to you for free. And it's so many of my patients can therefore, and in my experience, I've prescribed it a lot, and it's held up with all of the above things that I've mentioned.